My name is Daniel Leffler. I am from the Division of Gastroenterology at Beth Israel Deaconess Medical Center, where I serve as the Director of Quality Improvement in the Gastroenterology Division, as well as the Director of Quality and Research in the Department of Medicine. Thank you very much for taking some time today to hear about our recent study in gastrointestinal endoscopy, looking at the influence of time of day and case rank on adenoma detection rate. So as you all know, the main reason we do screening and surveillance colonoscopies is to reduce the risk of colon cancer. In an ideal world, we would look at the risk of colon cancer in our population that has been screened and look for a lower risk. However, colon cancer is a delayed outcome, and patients are often have moved around or are not in our system anymore, so it is very difficult to capture that as a primary outcome for efficacy of colonoscopy. In past years, we have had surrogate endpoints such as withdrawal time or cecal intubation rate, all of which were fairly far removed from that gold standard outcome of reduction in colon cancer risk. In recent years, we have moved away from those secondary endpoints to more closely related endpoints related to colonoscopy efficacy, the main one being adenoma detection and removal rate. As you all know, removal of adenomas removes their potential to turn into malignancies and thus is a sensible surrogate measure for reduction in colon cancer risk. As more centers have been reporting and evaluating adenoma detection rates, a number of interesting findings have been reported that potentially have significant public health impacts. And one of the most important of these was reports that have come out over the last few years suggesting that later in the day procedures have a lower rate of adenoma detection. In other words, the procedures performed early when endoscopists are perhaps more rested and more able, have a higher efficacy than cases done later in the day. This has not been a universal finding, but it has been shown in a number of studies. However, all of those studies had limitations, including retrospective design and a mixed patient population. In order to take a more closely grained look at this issue, we decided to look only at people coming for their first screening colonoscopies. So in our study, we took over 2,000 patients who came consecutively for their first screening colonoscopy and evaluated whether the time of day of the procedure or the case rank, that is the order in which the procedure was done compared to other procedures done by that same attending in the day, had a negative influence or any influence on the ability to detect adenomas in these patients. This was a single-center study done here at Beth Israel Deaconess Medical Center and involved over 30 attending gastroenterologists. A number of important findings came out of this work. The primary one being, however, that we did not see any significant association between cases done later in the day or cases done after a certain number of cases had been performed and a reduction in adenoma detection rate. That is overall very reassuring news for us as endoscopists, many of which perform full days of endoscopies, and really suggest that in general, colonoscopies performed late in the day and the afternoon are just as good as colonoscopies performed early in the day. The major factors associated with increased adenoma detection rate were male gender and increasing age. Both of those are very consistent with other data that have been published from the National Polyp Study and other projects. On further analysis, however, we did notice one interesting trend that is worthy of further study, and that is most endoscopists tend to perform the same number of procedures every day. That means if they do a full day, they might perform 10 to 15 procedures a day. If they do a half day, they might perform 7 to 8 procedures in a day. And usually those numbers are fairly stable. And as long as those numbers were stable, then we didn't see any deterioration in colonoscopy quality throughout the day. However, some days, due to procedural add-ons or other scheduling irregularities, providers would be asked to perform significantly more procedures than they normally did. So for that person performing a half day of endoscopy on a regular basis who normally performs 7, on one day they might perform 12 procedures. In that small group of procedures, those that are done on beyond a provider's normal procedure volume, there did appear to be a small but statistically significant decrease in efficacy at detection of adenomas. This was a secondary post-hoc analysis of our study and should not be considered to be definitive. However, it does suggest the possibility of a stamina effect, in which a provider can confidently do any number of procedures as long as that's a regular number of procedures they are used to doing. But if you push that provider beyond what they're normally capable and comfortable doing, you risk a deterioration in quality. And this is a new phenomenon that has not been observed in other fields of medicine, but is one that is worth further study, as it may have some relatively straightforward things that can be done regarding scheduling to make sure that, at least for screening and surveillance colonoscopies, add-ons well beyond the provider's normal schedule are not typically done. Otherwise, other findings in our study that are notable was the high correlation between detection of all polyps, detection of adenomas, and detection of advanced adenomas, suggesting that any one of these measures is actually a good measure of overall adenoma detection and can be used. Not all three measures need to be taken. In a lot of systems, it's difficult to measure adenoma detection rate, but all polyp detection rates are actually much easier to detect, and that appears to be a very legitimate thing to do based on our data. So just to summarize, I think in general the data from our center suggests that there is very little to worry about in terms of a deterioration in colonoscopy quality throughout the course of the day or with increasing procedure number. There is a possibility, though, that when days are much longer than they are normally for a specific endoscopy, that late case efficacy could be reduced, and this should be followed up in further studies. However, in general, patients should feel very comfortable scheduling their procedure at whatever time they are able to, and the endoscopist of choice is available at that time. Thank you very much for your attention.